All right, Governor, thanks for sitting down with us. There's obviously so much going on that we want to talk about here in Massachusetts. And I want to start, you yesterday announced a campaign to end veterans' homelessness. What does that look like?
You know, Katie, Massachusetts has really led the country when it comes to taking care of our veterans and military families, and I'm proud of that. But I also had the opportunity to appoint the first ever cabinet-level Secretary of Veterans Affairs in John Santiago. He's done tremendous work this year. We have new homes in Chelsea and Holyoke. We filed the HEROES Act, which I hope to see passed this spring. And he worked on this campaign I announced yesterday to end veteran homelessness. We have several hundred veterans we know here in Massachusetts who are homeless right now. They may be in shelter, but these aren't permanent situations. And my view is we need to do everything we can to support those who have served. They deserve it. And so this is a campaign using ARPA funds to go out and really work with these individuals, get them the services that they need. So many of them need mental health services, some for a variety of issues. But this will give us the opportunity to do this and show that here in Massachusetts we can continue to lead when it comes to taking care of veterans and military families.
Do you have a timeline in mind for this effort, or?
Well, as soon as possible. I mean, it's something that we're getting busy on right now as we speak, ready to deploy the teams to go out and get this done. And I hope we can do that and accomplish that this year, get to zero when it comes to our veterans and homelessness. I also really hope that we can pass the HEROES Act, because this would update our laws to give more benefits and protections to our veterans and our military families, and they deserve that. We have so many people in Massachusetts, always have. It's a proud history, 250 years of men and women who've gone off to fight and to serve our country. And we want to make sure that they are getting the treatment and the care that they need in housing, in services for mental health needs. We have a number of our female veterans and service members who've been victims of sexual assault and trauma. We need to make sure we're doing everything we can for them.
So that HEROES Act is one of several bills that you've filed that are still pending before the legislature. We have your housing bond bill, your economic development bill, which is also a fairly new piece of legislation. One of the things you have a focus on in there is artificial intelligence. What sparked your interest in that as something the state should really be moving on?
Well, my job as governor is to make sure that Massachusetts is growing, that we have a strong plan for economic development, and that we're really leaning into opportunities. One of the areas we identified is AI and applied AI. How can we use AI? So much of AI is being pioneered and researched and developed right here in Massachusetts. It's not just California, it's happening here in Massachusetts. How can we take those technologies and improve services in government, improve the ways that we deliver health care to patients, improve the ways that we speed transportation? There's so many applications of AI. I think Massachusetts has the chance to be this country's leader when it comes to figuring out how we're going to effectively use AI, and also how we're going to work to protect and grow a workforce with what's coming. AI is happening, AI is here, but I think Massachusetts can really lead when it comes to figuring out how best to use AI. I also want to note that in that economic development bill, not only is it $100 million for this new area, applied AI, it's also $1 billion for climate tech. We have the chance, Katie, to be a global hub for climate tech innovation, research, investment, jobs, everything that's going to be developed in the space of climate tech that's going to help us deal with the climate crisis that we confront as a world. So much of that's happening here in Massachusetts. So we have a way to grow Massachusetts as a global hub that is super exciting. I also propose continuing to invest in life sciences, which has always been a strong economic engine here in the state.
So that's a bond bill. It's not out of the state budget, but one of the things that as we do, and we're in budget season here, and one of the things that I know a lot of lawmakers are zeroed in on is the continued costs for the emergency assistance shelter system. the House is proposing to impose a time limit on shelter stays. Without getting into the specifics of the House bill that's still under debate, what do you think about the concept of limiting the lengths of time homeless families can stay in shelter?
Well, I'm open to it. I've said this about the situation. You know, it's so frustrating as a governor, and I talk to other governors around the country, that Congress has failed to act, that we've saw the blow up of what would have been a bipartisan deal on the border a couple weeks ago, would have taken care of these issues, would have solved so many of our problems. It didn't happen. It's very, very disappointing. And so we have to continue to try to manage and deal with the problem. What I have said, though, as governor, is that I am focused on, of course, you know, ensuring that we follow the law and get people housed. But more than that, Katie, it's been about getting people working. So many of our migrants right now, because we did the work to get them work authorizations, nearly 3,000 people have work authorizations as a result of my administration's work. They're working now in our hospitals, in manufacturing, in colleges and universities. So we need to continue to do that while we continue to call on Congress to act, to get us the funding that we need for our costs, to fix the situation at the border, to do the immigration reform that's needed. But you know, it's a federal problem that unfortunately states like Massachusetts are having to contend with. Half the families right now in our shelter system, remember, are Massachusetts families.
Right.
They're people from here. They grew up here. They've fallen on hard times, and so they're in what is supposed to be a temporary housing arrangement till they get to more stable housing. So I think that I'm open to reforms because I want the system to better work for families. Also, we can't handle the numbers that we've seen in terms of the new arrivals. So we need to put some guardrails. We need to put some parameters around that. I look forward to reviewing what the legislature sends my way.
What about a residency requirement, a length of time someone would need to be in Massachusetts before they're shelter eligible? Is that something you'd be open to as a guardrail?
You know, I think it's more important to think about what we're doing in terms of who we're letting in, time limits, those sorts of things. You know, residency requirements. We've got a lot of people who have family in New Hampshire, for example. They may come and go to in-laws over the border, and it's just to say, you know, I think we've got to be careful when we're having when we're talking about something like residency. But certainly the law is for people who are in Massachusetts. That's clear. You have to be in Massachusetts in order to be able to obtain housing. One of the things this underscores for me, though, is how important it is that we pass that housing bond bill. Remember, I proposed a $4 billion housing bond bill.
Right.
This isn't money out of the capital budget, operating budget. What it is saying to the legislature, hey, give us the ability to go out and borrow money to build more housing across the state. It's the #1 challenge for our state right now, housing. You know, so many people who can't afford rent, can't afford new homes, can't afford to downsize even. And so for our young people, for our seniors, for businesses who want to be able to land and recruit and retain talent here in the state, we've got to go out and get this done, to work on the development, to speed up the development. I said at the outset when I started office that my job was to make Massachusetts more affordable, more competitive, more equitable. We've worked really hard on all three of those fronts. But driving down housing costs by building more housing is something that we've got to do.
So, and of course we've seen, as we're talking about housing, we've seen Milton push back against the MBTA communities law and the multifamily zoning requirements within that. Are you concerned about that other towns might follow their lead and kind of resist this law that was passed a couple years ago but is just now starting to take effect?
Let me say this, I love our state, all 351 cities and towns, but we're not going to solve our housing crisis town by town, city by city. It requires everybody working together. When I talk about leaning into life sciences, I recently was with a search firm that recruits for life science talent to come into the state. They said the #1 problem they face in interviewing people who would want to move to Massachusetts is they can't afford to live here. They can't afford housing. So whether you're hearing it from businesses, whether you're hearing it from residents or families, you know, we know that this is the challenge that we've got to deal with. And so what I say to communities is, look, there's a roadmap there. There's a law that simply requires you to zone in a certain way to allow for more housing. The law doesn't actually require you to build more housing, though we want you to do that. We as a state are going to continue to work with cities and towns, providing technical assistance on how they can get there. But housing is good. Housing is good for the vibrancy of your community. It's going to mean more people staying in your community. It means people who are getting older in your community are actually going to be able to afford to live there, right? We've got a lot of grandparents who are moving away. They can't afford to live here. We've got a lot of young people who grew up here, maybe went off to school somewhere and come back. They want to build careers here, but they're not able to do that, and they're looking elsewhere because they can't afford housing. That's not good for our state. So ours is one of partnership, collaboration, but we mean what we say. The economic future of this state depends on our ability to build housing. That's not just new starts, it's also the rehabilitation of existing housing infrastructure, right? We've got a lot of buildings out there. I've also put state buildings in play. Let's use those and turn those into housing units. So this is just so important to me. It's going to be, you know, the thing I continue to harp on and talk about. And I mean it when I say we're going to work with communities, but people got to realize our destiny, your destiny, you know, as a community is totally dependent on our ability to deliver and to produce more housing units very soon.
So as we talk about Milton, I know the Attorney General has filed suit there. Now, you were Attorney General when this law was signed. You're a lawyer. Are you confident in the legality of, you know, the state being able to kind of make these zoning requirements of cities and towns that typically have a say at the local level on those matters?
Absolutely. The Attorney General is right on point with the law and what's required. And it's just my hope that communities who are questioning this can work with the state and, you know, understand that this law was intended. And by the way, nearly unanimously passed by the legislature and signed into law by Governor Baker. This law
passed in a really big economic development bill. There wasn't like a specific vote just on this policy.
But there was a lot of talk about what this meant in this particular MBTA Communities Act. It's the law. It's, you know, more than just a law. It's a really important policy piece. It's what we've got to do for the health and well-being, the economic growth and development of our state. You know, I want Massachusetts growing. I want Massachusetts thriving. If you grew up here, I want you to be able to stay here, raise a family here, grow a business, grow a career here. I want companies to think about and employers to think about growing here and expanding here. We're a wonderful state. We offer so much, but it's not so wonderful if you can't afford to live here.
Sure.
And housing is the top challenge.
And we saw, you know, your administration pulled back a grant from Milton in keeping with the way the law spells that out. And around the same time, we saw you taking a stance about the situation with Steward Health Care, calling for them to leave Massachusetts. I'm curious if now that you've been in office more than a year now, if we might be seeing more of you using the bully pulpit as you approach your job.
Well, you know, I don't come with a particular game plan or playbook about it, Katie. What I just try every day to show up and work with our great teams, and I'm so lucky to work with so many great people across our administration and cabinet, to just make the calls, make the judgments that I think are in the best interest of residents and this state. You know, when it came to Steward, obviously I'd known Steward. They've been around. I've been Attorney General.
Sure. Dealt with them before.
And I dealt with them before. And in fact, you know, I had been in court against them, asking them to produce financial information years ago, and they fought it every step of the way. They're still on appeal. But on Steward, I'm concerned about protecting patients' access to care, protecting jobs, 16,000 of them in the Steward system in our state, and protecting the stability of the healthcare market. And so we're going to continue to work on that as we manage an orderly transition of Steward from the market.
Yeah, where did things stand on that front since you kind of issued that call for them to transition out?
They produced more information. More importantly, our Secretary of Health and Human Services, Kate Walsh, is working directly with the provider community, also with Steward, with the lenders. You know, again, this is about trying to manage what is a most unfortunate situation that came about because of corporate greed and greed of executives who basically came in to the state years ago, took over hospital systems in particularly vulnerable communities, essentially and effectively have stripped those hospitals of a lot of assets, and we're just sort of holding on here. And I think I'd like to think that we're going to get through this and get through this in an orderly way, making sure that we are protecting patients, protecting workers, and protecting the stability of the market.
I know the legislature has announced plans to look at the role of private equity in healthcare. Is that something you think there's maybe room for legislative action or other policy reforms on?
I think that we need to take a hard look at what transpired here and if there are things that we can do going forward to prevent that from happening again. I'll also say that the structure and the laws were in place. Steward just chose not to follow some of them, and that's some of the issue of what's going on. But for me, what I'm focused on is how do we manage the current situation so that we're protecting communities, protecting patients, and protecting jobs.
On another matter in the healthcare realm, I want to ask you about reproductive health care. I know there's been abortion access laws passed here. You took action to stockpile mifepristone, I think last year that was. Do you have any plans or think there needs to be anything done to make sure that access to IVF is protected in Massachusetts in light of the Alabama ruling?
Yeah, I'm going to continue to be a strong advocate for access to reproductive health care, access to abortion, medication abortion. It's distressing to me, more than distressing, not surprising with the court that Donald Trump appointed, that we've seen what's happened. Dobbs was just the start. The decision by the Alabama Supreme Court banning IVF was a continuation of that. Here in Massachusetts, we're going to continue to protect IVF, medication abortion, access to reproductive health care. That's clear, and I know that the legislature has also been clear about that. But I think in this time and in this moment, that's my message. I continue to work with Democratic governors around the country on protecting access to abortion and needed care. But clearly, it's under threat by legislatures around the country, by courts, and by presidential candidates. So we need to be strong here in Massachusetts, and I certainly will be as governor.
I want to ask, I know when you took office a year ago, there was kind of a lot made in the run-up that this was a change in the party control of the corner office, and a lot of people were raising the question of if with a Democrat as governor and Democrats in control of both the houses and the legislature, that there might be a power struggle over who sets the agenda. I'm curious if you think that's come to pass, or what your approach is in working with lawmakers.
I like to think I had a great working relationship with the legislature as Attorney General. Obviously, as governor, it's a different role. I'm a basketball player. I'm a point guard. It's about teamwork. It's about working together. That's how we move the ball down the court. And the same applies, I think, to my style of leadership and governing. I respect and I think have worked well with the legislature. We got a lot done last year, and I'm proud of the work that the legislature and our administration, what we were able to do together. Tax cuts, $1 billion in tax cuts for the first time in over 20 years. That's something we delivered last year. People will see real savings in just a few weeks. Universal school breakfast and meals, free school lunch and breakfast for every child in the state. Community college, free, no cost for people who are 25 and older. We've already seen a double-digit increase in enrollment as a result, which is great for our pipeline, for our workforce. So those are just some of the things that we were able to do. Landing ARPA-H, being awarded the nation's hub of medical and health innovation. That's a big deal. Working to bring back $3 billion in federal funds last year alone that we're going to use for infrastructure, for transportation, for workforce investments. A lot of good stuff. It's a new year. I just filed a new budget. I look forward to more work ahead with the legislature. Top priority, of course, is housing and economic development.
A lot of the things you mentioned that have been accomplished so far are things you talked about on the campaign trail in your inaugural address. Another thing you mentioned in both instances was childcare costs. You talked in your inaugural address about wanting to pass childcare legislation. Is that something, given the point we are in the calendar, is that something you think could get done this session?
Well, I think it's really important. It's really fundamental. I was with the United States Secretary of Commerce, Gina Raimondo, recently, and we were at a business roundtable discussion, and she talked about the importance of childcare is foundational to business and economic development, and it certainly is. It's something that I've leaned into as governor. It's why we proposed in our budget funding, significant funding, historic level of funding for childcare, which the legislature passed in the last budget, so that's good. It's also why we've renewed that in this recent budget that we filed, stabilizing our healthcare system, by making sure that we have the providers available, by making sure that we're expanding seats. I've called for universal pre-K in all of our gateway cities within 2 years. That's something I'm committed to. It's so important. So, we'll continue the discussions with the legislature, both in terms of what this means through the budget, but also in terms of what we're implementing through our own Department of Early Ed.
Yeah, I know. Elsewhere in education, your education secretary, Patrick Tutwiler, I think indicated recently that you'd oppose or you don't support the question, the proposed ballot question to remove the MCAS as a graduation requirement. I'm curious about your thinking on that question.
Well, I think the ability to assess is really important. There could be a question about what it is we're assessing when it comes to young people, but I think it's really important that Massachusetts maintain a system of assessment like MCAS, a system where we're able to measure how young people are doing. That's important to me, and I think it's part of why Massachusetts is at the top, is we have had an ability to assess our students and then deliver both to students and educators the support, the resources that they need to get the results. So that's where I am on this. I look forward to continuing discussions through Secretary Tutwiler in terms of what we can do to help improve outcomes K-12. I recently launched an initiative around literacy because Massachusetts leads the country in education, but I also know there's more we can be doing when it comes to literacy and making sure that students and educators are given the tools to teach the science of reading, evidence-based curricula that we know yields better results when it comes to reading, because every child in this state of ours, where we're home to the first public school in the country, the first public library, we've got to be absolutely #1 when it comes to reading.
Do you anticipate getting involved in any of the ballot question campaigns, either for or against? I know your predecessor did in some instances.
Too soon to tell. I have to see what they are. Right now, we've really been focused on implementation of existing priorities. Just filed a budget not too long ago. We're in the middle of the legislative session where, we're testifying before committees on housing, on economic development, on municipal reform, all sorts of things. So, we're busy with that. Hard to say what will happen in terms of any ballot initiatives.
All right, lots to do. Thanks so much
Always
for your time,
lots to
Governor.
do, but happy to be able to have the privilege to do it. Thanks, Katie.
Appreciate it.